need to do steroids. So I injected him with a steroid injection. And knowing that it's probably not the best thing for him, he had 3 months of fabulous relief. He said, "Doctor, you're amazing. Thank you so much. I'm working again." 3 months later, he came back. My elbow hurts. It's now even worse than before. We scanned it, and it was actually a little bit bigger. So he had felt good, but what were we doing? We were masking the pain, right? And the tear was a little bit bigger. So I said, okay, let's try this PRP stuff. So there's the needle. You can see the tear on ultrasound. So the nice thing is we can precisely guide it into that tissue, and we inject it, see the needle placed right into that tear. And he came back about 5 months. He said, "Doc, I feel amazing. Things are really improving. It's not completely better, but it's feeling really good." And when I scanned him, I looked at it and said, "Wow, it looks actually worse." I said, "Are you actually?" It looks, even more white, right? So it's more inflammation. What I realized in retrospect is that you come back several months later. This was the proliferative phase. We talked about inflammation, proliferation, maturation. This was the phase, so it's actually, the tear is less discrete. You can't see those margins. It's just this kind of fuzzogram. And you can see here, see how it's very precise? And here, it's kind of fuzzy. So I brought it back after a year, and that's what it looked like. Right? So it's healed. So it takes time. So that was an interesting learning moment for me, and that's the scan. So we can see that on the top left, the tear after steroid, a little bit bigger, more painful, and then the tear after the injection. And so we're going to go through, we can kind of skip through these. These are several images of needle placement and tendons. So luckily I get to speak nationally, internationally on this stuff, so we go through these. This is another tennis elbow where there was a pretty significant tear, and you can see here with the arrow, the tear, and then the next picture shows that same tissue healing. So we're going back to that rope appreciation. So this is another injection, and we see, this is an ultrasound exam. You can see the tear on the top left, and over time, that fills in and heals. Who's heard of sports hernia? Like for athletes? So soccer players, any soccer fans, Timbers fans? Yeah. Diego, right? So he had an injury a couple years ago. So this is what it was. It's basically where we all have 6 packs. They're underneath there somewhere, but we all have them. And they attach to your pubic symphysis, and your adductor muscles, the tendons for your legs, they attach at the same spot. There's a confluence that forms. And when you get tears in that area, that's what a sports hernia is. It's a little bit of a misnomer, but that's what that tissue. So when you do an MRI, you can actually see it. And so you can see here that this is the right side of the screen is normal. So this is where the tendon attaches. You can see here, that's normal or more normal. And this white area is a tear. And this bright area here is where the tear is pulling the bone. And it's like the periosteum. The covering of the bone is getting torn. It's extremely painful. So the athletes, cutting athletes, running athletes will get this pain in the abdomen, and when they rest, it feels better, but as soon as they go back to training, it hurts again, and it's very hard. Why isn't it healing? So it doesn't heal very well. I'm going to ask the students here, why is that not healing? Why might that not heal? What are we talking about today? What's not getting to that area? Blood, okay? And so not very well vascularized. So blood's not getting to that area, so it doesn't heal very well. So what can we do? Inject it, right? Pretty simple. So we injected it, and you can see over time, that's the pre and the post, that stripe along the bone, that healed, that's the periosteum, and then the tendon is filling in. This is looking at it from the side. So we make slices from the side. The front is on the left of the screen, the back side of the body is on the right of the screen. You can see that big white gap is filling in. We started this with tendons and ligaments. We weren't sure if it worked. It's easy to get to, it's very safe. And then over time, we started to realize that anything we put it in, it started to heal. Like any tissue that you put it in, tendons, ligaments. And so what we were doing kind of more invasively is we do a lot of spine injections. And spine is really, is delicate. There's a lot of issues that are there, a lot of vessels, and obviously your spinal cord. So we have to worry about injury. So we slowly, over the past 10 years, I've been doing this for about 10 years, we slowly moved into the spine. But the interesting thing is, wherever you put this tissue in the musculoskeletal system, it seems to heal. And so, who's had back pain, right? More of the adults. disc issues, arthritis, things that happen in the back, we're actually able to heal that as well. And so we started to take these platelets, these stem cells, and interventionally using live x-ray, so you can see that needle, we can put it into the discs, and we're actually healing the discs. So you can do this procedure, so if you have back pain, one of the standards of care right now is surgery. And so they cut you open, and they put these big screws, you can see that middle picture, into your back and fuse the tissue. That's one of the standards of care, which is frightening. There are a lot of patients, we've got about 70-80% success rate of taking your platelets, taking your stem cells, injecting it into the discs and actually healing it. And so instead of leaving with a fusion, a scar, and 6 months of rehabilitation, you can leave with a needle and a Band-Aid. And so that's the future. So biohacking is what you're talking about. So it's gonna be the standard of care. We see it working so well that everybody's gonna be using it soon. So you're gonna see this as your standard of care that's gonna come into your Providence Healthcare in the near future, because it will happen. It's a lot cheaper. This is a patient, a 42-year-old female, extremely healthy, active, and you can see on the left side of the screen the discs in between the bones. See where the circle is? The discs are bulging. So the tissue, this is the bone into the back there. You see how that tissue is bulging out? I'm not sure if you guys can get it. I wish I had a laser pointer. But on the right side of the screen, that was after therapy into the discs, and it's healed. And you can see here, this is the spinal canal. That's where your nerve roots live. And see how it's compressed? It's tight. We injected this disc, and see how much more room there is here? That disc healed. And so that's what we're seeing for the spine, which is fascinating. Again, paradigm shift. And so just to close, the good news is we can heal ourselves, and there's technology that's driving this. So if anybody's interested, let me know. I can give you articles and kind of foster the learning, especially the young people here and the students. I think it's a very fascinating field, and hopefully you guys are interested in this. Thanks for having me. Any questions?
Would you benefit from better imaging of what parts of the body that you're would better imaging of the body or the interior of the body help with the practice that you're doing?
So yeah, my philosophy is when patients come to me, the most important thing to start off with is diagnosis. Okay? You can have the best stem cells and most amazing injection, and you can put it in the wrong place, and it's not going to do anything. Right? So the most important thing is to get the right diagnosis. One of the tools to get the right diagnosis is imaging. But you also have to talk to the patient. When does it hurt? What do you do to make it hurt? You can examine them and push on them and those types of things. And then this is another tool. It's not the end-all be-all, right? So that's one thing, unfortunately, today, some people use it too much. They say, oh, that's what is causing your pain because the MRI shows it, and it may not be causing the pain. Or they think the MRI shows too much, and they ignore it, and they just focus on that. So I think it's a tool in the tool set, but it's not the whole thing. But the better the imaging, like we talked about those fluid-sensitive sequences that it shows the inflammation. Before we had that, it was really hard to tell where the information was. So that's a really helpful tool, and the better technology gets, the better diagnosis that we get, and the better treatments that we'll offer. And the patients will get better faster.
So you had said that the platelet injections are a lot cheaper. So for hospitals, they would end up getting less money using the platelet injections than doing surgery. So is it for them? Are they trying to combat this the injection therapies and try to stick to the surgeries as an economic benefit?
Yes. So the conspiracy theorist in me says yes. Right? There's definitely motivation. People go to a school for a long time to do a certain thing, and then when that thing goes away, there's kind of fear and worry about economic security. And so I think that there's definitely an issue. But how I combat that, and I have a lot of friends that are surgeons, right? Colleagues. I send them a lot of work because we fail too, and there's a large segment of the population that needs surgery. Is fantastic. It heals people. It fixes people. It changes people's lives, but it's not the tool that we should go to first. Right? So imagine that we could do these injections and 50% of the patients, or even 30% of people could not have surgery and be healed by this. It would make a massive economic and social impact, right? And so that's the thing that we have to think about, that this does work, and there'll be plenty of work for other people, but this should be a piece in it. Right now, unfortunately, everything I'm showing you is not covered by insurance. And so patients have to pay out of pocket to do these. They're not cheap. Some of those like spine injections are not cheap therapies. And it's when they come in for an injection like that, that's a 5-hour day. We use a sedation nurse. We have to get put a big needle into your bone and do liposuction, and so this is a pretty invasive process. It's not covered by the insurance. But imagine that whole process is cheaper than simply the anesthesia that they use for a surgery. So a surgery in like a hospital, a knee replacement, is probably $50,000 in the hospital, the total cost. This procedure is about $5,000, right? Just the anesthesia part is cheaper. But remember, there's big pharma and companies that have a lot of investment in what they do that are going to push towards that. It's hard to monetize this right now, and so that's what you're getting at. I think it is where it's a grassroots movement that we have to talk about. Hey, this stuff is working, and it should be implemented in our healthcare system because it's going to save costs, right? And we talked about the futurist. I have 4 daughters, going on 5. We don't know if it's daughter or boy, and I want them to live in a wonderful society. And this is going to, like, surgeries are going to cost us too much, and they'll break the bank. So we have to look at these technologies to help society.
I have one question.
Sure.
Talking about monetization, would it be possible for me to take my own stem cells stored and then retrieve it? That storage results in a monetization opportunity for several businesses.
Yes. So here's the interesting thing. In this country, I can take your stem cells and I can bank them. I can multiply them so that they could be used for different issues down the road. And the younger you take your stem cells, the better they are, the smarter they are, the healthier they are. As we age, the stem cells age as well. And so the problem with this country right now with the FDA, and I've been the NIH, I've spoken there, I've been pushing this agenda, is that I can't get those back and inject them. So I can take them from you. I can pay someone to store them and multiply them. But in this country, it's illegal for me to get them back and inject them back into you. So businesses have developed where you can fly to like the Cayman Islands and get that done. They can store it and they can inject. So a lot of NFL football players that want to increase their longevity, they're flying down there, they're getting their stem cells banked, and then they're injecting them back in, out on an island somewhere. That's why we joke about getting a cruise ship and going 7 miles offshore in international waters, and then doing a stem cell cruise and inject it. But yeah, it's very interesting. But right now, so we have to do it same day. So when we do these stem cells right now, and the FDA is looking at potentially stopping what we do, and a lot of the push is from big pharma and big companies to say, hey, we don't want this stuff because it's working too well. We can't monetize it, so you shouldn't do it. And so that's kind of the scary part. But yeah, there's a ton of opportunity, but part of it has to be legislation. And so we're working, we're publishing data. They need to see that information. And then we're also going to private insurers and talking to them that, so there's one company in the Midwest, it's called Hy-Vee, it's like a Fred Meyer company. And what they did, one of their CEO was told that they needed knee replacement, and they didn't want knee replacement. So they went and had this stem cell procedure, complete resolution of the pain, doing super well. So they did a pilot study with their executive team. I took, I think it was 30 of their executive team. They went and basically any musculoskeletal issue, they broke it in half. So 15 of those could have any of these stem cell procedures, 15 had to go to orthopedic kind of standard of care. And they looked over 3 years and they saved 82% in cost, time savings, time off, post-surgical complications. And so now 150,000 employees have full access to this type of care. And now it's been 2 years and they're still seeing a significant, greater than 50% reduction in their healthcare costs. So that's where we're looking at really moving the needle, because it's costing these companies, and especially it's the companies that insure people in this country. and it's costing them a ton of money. So Intel has $1 billion healthcare budget, and a lot of that is spent on musculoskeletal care and time off and missed days and narcotics and all the other things that come with poor care. So that it's an interesting business dynamic as well. Yes, sir.
So, I was kind of interested in the 3D printing of the parts of the body that you talked about.
Yeah.
So, what material do they use for that, and is it like safe for the body and stuff?
Yeah, so they're synthesized. I don't know too much about it, but they are synthesized collagen. So they're basically like the scaffolding. So they're collagen, they're proteins that they have, and that's the scaffolding. And what they do is they infuse cells, smart cells, into that tissue that develop into the different tissue types. So that's where the intelligence of those cells is really important. So they can inject certain things, like if you look at a kidney, there's different types of structures that develop in that. So they build a meshwork, but then the cells are infused into that area, and they're programmed to develop into different types of tissue. So the basic, like the foundational, the 3D printing is based on collagen proteins. And there's different types of collagen.